What about the poorest among us? The ones without transportation routes nearby, or rural Americans whose nearest pharmacy is 50 miles away, not 5. What damage besets a community that isn't in reach of those more temperature-sensitive vaccines? Today's discussion is on the pause of the Johnson & Johnson vaccine. 1 week following the pause of the J&J vaccine, the temporary stay has been lifted, this time with guidance from the CDC and FDA to inform select groups of potential risk. About 2 weeks ago, the CDC reported they'd found 6 incidents of clots, one of which was fatal, in a pool of 6.8 million vaccinations. At those numbers, there was a higher chance of you getting struck by lightning than experiencing an adverse reaction to the J&J shot. At the time of the pause, the only people to encounter these side effects were women, all from the age of 18 to 48, the same age range that would suffer from birth control-induced Bloodclots, which happens at a rate of 3 to 9 women out of every 10,000. Now, the point that I'm trying to make isn't, oh, it's just women, let's keep the ball rolling. My point here is to highlight the hypocrisy of our public health advisors. For the last year, they've tried to hammer into us that during a pandemic, everything is a trade-off. We can't get everything we want, and in order to return to a semblance of normalcy, some concessions have to be made. Expressing that the virus was so dangerous that any potential side effects of the vaccine would be nothing in comparison to the actual virus, and as a tiny side benefit, would also completely eliminate the risk of death at the hands of the virus. But they seem to have abandoned that mantra when it was their turn to follow it, even though they knew the affected demographic and how to treat them. I'm not at all suggesting they should have continued to give the shot to them. I just wanted to know what was wrong with the warning label, and if they genuinely considered the harm this pause would do to everyone else, let alone the overall vaccination efforts. Whoever decided that this statistically minuscule risk wasn't worth it, where did they live? Were they in major metropolitan areas with pharmacies on every corner? Did any of them have families in the boonies that could only get their hands on a J&J vaccine? The reason so many communities were overcome with relief following the news of the J&J vaccine is the storage requirements made it instantly clear that it could reach parts of this country that Moderna and Pfizer could not due to their storage requirements. So I just want to know how the CDC and FDA responded to the concerns of their loved ones upon hearing they'd been robbed of the ability to receive the only vaccine that was regionally available to them. Now a week later, FDA and Johnson & Johnson are now updating the vaccine's label to carry a warning about a rare risk of blood clots paired with low counts of platelets, leading today's discussion to be, why do this now? J&J was a godsend not only to rural Americans, but billions around the globe who benefited from the hardiness of this vaccine, stable at refrigerator temperatures, and able to be stored longer than all of the others, making it perfect for populations that lack the resources to store and transport at ultra-cold temperatures. At the time of the pause, they said 2 things: that the demographic at risk of this side effect was known to them, and it was minuscule, and that they'd pause it simply to prevent physicians from mistreating the blood clots if and when they occurred. If they knew these 2 things, why even pause the vaccine? They've told us numerous times throughout this pandemic that concessions had to be made. But when it was their turn, rather than be honest with the American people about the side effects, warning healthcare providers so that at-risk groups knew what to watch for, they balked. Despite us making concessions for the last year, the people in charge were unwilling to trade an incredibly rare risk of blood clots for increased vaccinations. They removed choice from people who would have preferred one shot, they prevented vaccines from reaching those in rural communities, and they heightened vaccine hesitancy in general across the world. And that hesitancy isn't something that will magically vanish once the vaccine pause is lifted. They were always facing an uphill battle when it came to vaccinating populations that felt this vaccine was developed too quickly. Yes, lying to them about the risk wouldn't have been a good idea, but pulling the vaccine didn't increase that trust, it flattened it, giving the virus more time to mutate, making it harder for us to return to our regular lives as we knew them, and putting countless people at risk. We understand everything is a trade-off. We've done nothing but give up our freedoms and make compromises for the last year. So let's discuss. If stopping the spread of this virus at all costs was so important to them, why'd they trade 1 in a million odds of blood clots for potentially millions falling victim to COVID and achieving faster global herd immunity?